here with the sign in the backdrop, and then we'll use that for our new.
He likes to use AI for his posts.
I like the AI post.
I think it's cute.
I've never looked better.
The ones that you make are cute. I generally like. There's actually statistics like with certain gems that don't even look at like an ad that is made by AI because we know. And so yours is good though. I like yours. It doesn't look like little boxes everywhere and repetitive stuff all over. Is what I hate.
Okay, you're up.
Will you take a photo of
I
us?
think we're too far away. We're
Yeah,
live,
on-
by the way.
Okay,
It's on.
but we have to be this far away.
It's on
Because it's a split
purpose.
screen. God damn it, Tiffany.
What'd you do? Don't do weird stuff. We get our photo taken. Okay, so what we're gonna have to do is we're gonna start like this, and then when we start to show models, you'll have to scoot forward.
That's fine. So you parked in my spot.
Yes.
So then Daisy had to park in Amelia's spot.
Yes, she
so then
did.
I had to park
So
in
when I
Daisy's
pulled
spot.
in, I
Yes.
was right, and then I was like, "Fuck!"
So then,
As she was parking,
Okay,
and
we're
then you
live,
called me.
so-
so then I pulled in and I like pointed at Daisy. I was like, "Yeah, move over a spot. That's Bowman's spot."
That's when he was talking to me. And I
Yeah,
was like,
we were
"Oh,
watching out the window, and I'm like,
Will you go grab my Stanley?
I parked in the shade, so
I woke up
sorry.
with like no voice this morning.
Oh, good.
I feel fine. I just have no voice.
Can you say hi to your people?
Hello, people. No one will be able to hear me scream in the MRI machine.
Get 2 small black chairs. It will fit them better.
Get them to the ones.
Tell
And then Daisy, will you-
Amelia it's fine.
Bailey says it's fine. Thank you. We went live, but I'm trying to get my. I'm gonna cover my mouth for a second. I hate when people clear their throat and I'm like,
I see what she's saying though. If we were just in little black chairs,
But this is what it looks like on Instagram.
"Oh, we look good on Instagram. We always look so good on Instagram."
we're so gram worthy.
Can we bring this a little?
Thank you. There was no ice this morning. You took it all. Took all our ice.
So
Such an ice taker.
we don't have pictures or anything to show crowns, bridges.
We have the model. It's in the top drawer.
Okay. The big, huge, wonky one.
Yeah, it's the giant one in there. I can grab it. I know which one it is. I showed it to a patient yesterday. Yep.
With that guy.
Yep. And the implants in there. Yep. And there should be a single crown in there somewhere. Okay, we've lost the single crown. That's good.
Yeah, the little one that goes on top of it.
We've lost the single crown, everybody.
That's what can happen with crowns. You can lose them.
You can lose them.
I mean, you can tell
All
them
out.
that it's. You can show the because it has a little bridge on it, right?
This will show a bridge. Where's the crown?
I mean, crown and bridge are kind of the same. I can break off the bridge and make a single crown.
Yes, you can.
Go get one of Dr. Emmett's new zirconia burrs.
Yeah, we can cut it off with that.
Looks really nice, babe.
Thanks, guys.
Nope, I just barely walked in.
What have you been doing?
We didn't get here that long ago, and I just was out there sending an email to the lab, seeing if they could stop making Huey's teeth.
Mm-hmm.
I shouldn't have said his name.
Yeah, that one. It's fine.
Yes.
Nobody knows who that is.
There's a bunch of.
But he messaged me last night pretty late and said, I want to keep my teeth the way they are right now.
What?
I'm like, oh my gosh.
Wild.
That's another hour of planning, reversing everything back. It's
I
okay.
submitted it yesterday.
So they might already be milling it.
Yeah, they may already be milling it.
Or we're like last
They
on the
tried-
list.
They try to get. We're not last. We're first on the list.
I'm being positive. We're last on the
It's like
list. and
Robert's.
doing 20 other
Robert's walk. Emmett. We're definitely not last on the list. All of our stuff gets sent. We need to send them lunch this week.
Do we really?
No, we're going to.
Are we going
Can
to?
I have
We've
that?
talked about it. Are you gonna? You're not gonna wear yours?
Yeah, this week is perfect. It's a
So
holiday.
Millie said she can hear all of our swearing, so we should mute until we start this thing, or we got to clean up our potty mouths.
I haven't said a swear word.
Yep, you did.
What did I say? Yeah, you said that.
Oh.
I didn't say that. It's like, no.
Do you want to go mean?
No, it's
But I
okay
didn't
because
think
this
so. You
thing's
have
starting
5
in 5
minutes,
minutes,
so-
so it's totally
Start.
fine. How come we're doing it at 10 o'clock today?
We're
Actually,
doing
I'll bring
it-
that up on the actual call.
the call.
Should we print off a
Cute little boomer,
picture of any of this stuff that we don't have?
like a veneer, or just a single crown. I don't know where the crown went. That's kind of
I don't
making
know
me.
why in my head I was like, oh, you'll just print off what looks like a veneer.
We'll just talk about what a veneer is. Veneer. The thing is, veneer doesn't replace a tooth. We talked about replacements. Oh, but we've got fillings and stuff on there.
Yeah.
I need to call
You can't
Ben's
really show
office.
fillings either, so.
I need to call Ben's office. I need to go in just for a full.
Partial
Like, we have
implant
to get some
denture
pictures that we do.
terminology.
We go.
Just go print off a picture of a
Where was that printed? That color looks nice.
on our printer here.
Oh, okay.
Really?
Just about 10 minutes ago.
Great.
Dang.
Will you print off a picture of a crown,
It's obviously
And a
normally not
veneer.
that
A
nice.
crown and a veneer.
Crown and a
bound, and a cranier?
I don't know how you print off a picture of a filling.
So, you know, we built that really pretty wall in our house with all the E's on it.
Yeah.
And there's a table right there that's really pretty. pirate ship table.
Pirate table.
So my car parks right in the very back corner of that garage.
No.
And this morning I started the car
No.
and it went vroom, and every picture on that whole thing rattled like the wall was going to fall down. So
Nothing fell down.
nothing fell down, just all rattled.
Thank goodness your wife is really good at putting all that stuff up.
Thank goodness she's really tolerable.
Yeah.
I put it up. She picked the placement, mind you. She did, but I hung it up.
Good job.
Thanks.
Well
Appreciate
done.
that.
Well done. I have got like.
Well,
It's
go
really
over there
annoying.
and good.
It's been.
So even if you good, good.
I just covered
Over
up my mic.
there and undid it.
I don't know what I did. Like it's.
Went camping.
I mean, yeah, I did go camping, but
That's why you guys
went to the
Oh, yeah.
Grand Canyon.
So, yeah.
just like normal.
Just like normal.
Went to the Grand Canyon. Fed deer
So weird to me
at
that
the
you
Grand
went and
Canyon
fed
deer
deer at the
place.
Grand Canyon.
Like not.
But you went
at-
to-
not,
The best part, the coolest name of the thing you went and did was Bearizona.
yeah, Bearizona.
Bearizona.
Just Bearizona.
You got to add the
No one-
Izona.
no one says it.
Bearizona.
Yeah, no one says it that way. Everyone just says Bearizona.
4 minutes till we start.
But the best part of that whole thing
Mhm.
was that I shouldn't have been able to get so sunburned. But the first day that we went to the deer farm in Bearizona and all that,
Deer farm.
I didn't
Is it
wear,
a petting zoo?
it's
the
a
deer farm?
conservation thing. So these little babies have gotten abandoned, and then they take them there, but then they can't really like release them back into the wild because now they've had like human interaction, and they'll just walk up to humans.
Mm.
So you go there and you buy.
That was a little far, Bailey. Or am I still in it?
Hold on, just kidding.
let Bailey work her magic.
Let her cook.
Yeah, let her cook.
Should
You
we
buy
get
this,
smaller chairs? Is that really a thing? I can go get smaller chairs
Hold on.
because I can get them within 1 minute.
I'm
Yeah,
like,
maybe.
I
Maybe
love this
Amelia
chair.
was right.
I love this chair.
Maybe I lied, guys. I'm sorry.
I lied, guys.
I thought I was right.
Yeah, so he parked.
Will you
in
guys
this
move the
spot.
first class chairs? We got some coach chairs coming in.
Yeah, I like the first class chairs. I'm a
It's
first
too-
classer.
It's too bad, Tiffany. We gotta move.
Ugh.
I'm sorry.
It's okay. I'll get over it at some point today. Can't be any worse than what I'm going to go do at noon, so it'll be fine.
I did that the other day too.
Yeah, I did it with the chair though. You did it with your
Oh.
foot.
Are either of these okay?
Yes.
You know what, I can-
No, that's great.
That's not good. That one's great.
Perfect.
We don't have to sit that close like we're actually in a little airplane. My buddy Jeff could appreciate this. This is how you fly in his plane.
Is that really how close?
Oh my
you are
gosh.
to your
Like
phone?
literally, you're this close in those little airplanes.
Does he watch your live?
Which is weird because
No.
me and Dr. Emmett both have this weird thing about thighs touch like if you ever sit down in
I'm
an
gonna
airplane.
Move this so you can read our sign, and then I
This-
want you two to frame yourselves so you can actually see. There we go. Look at that.
Great. We tilt it up a little bit so it's not just showing my big belly.
You guys
Yes.
will look up for a
Like
second.
that.
Great.
Beautiful.
The
Almost on the start.
the best part is if you ever fly with Dr. Emmett and he's in the middle and someone sits on that end, if they sit down and immediately just like put their thigh against his, he will be like,
My thigh can't touch their thigh, so I have to turn this
so you have
way.
to turn into me. And
So
I'm like, this is gonna be great.
we make it work. Hey, should we
Yeah,
start?
We want to
Yeah.
fly
Go
Okay.
first.
ahead and do an intro.
So, good morning, everybody.
Good
There's a
morning,
few people already
everybody.
clicking in. We can see that.
Oh, sweet.
Probably lots of people that watch us all the time. We hear a lot of people are like, "Oh, I watch your lives every week."
I watch your lives.
So, good morning, welcome. Do we not have a separate camera for Instagram?
Nope, they're on the same one this time.
So
Wow.
so Instagram can still watch everything we're doing.
And it's here.
Okay, so we have Instagram, Facebook, and YouTube with us today,
Sweet.
right?
Yeah.
I got it right.
All
But
the
you'll
things.
notice that the format looks a little bit different today. We have a second camera set up so we can show some models because we're always holding up papers and trying to do stuff. And today we decided to try a new trick.
Don't worry, we still have papers to hold up.
Yeah, we'll still hold up papers.
We'll still hold up some
But
papers.
I'm Dr. Emmett, and we are in Las Vegas, Nevada. And this is,
I'm Tiffany. I'm Dr. Emmett's assistant.
we were somewhere recently and you said your name was Tiffany Emmett.
No, I introduced myself as Daisy to Dr. Tran.
Oh, that's what it was. Oh, I'm Daisy.
Daisy said, "Hi, I'm Daisy." I said, "Hi, I'm Tiffany." I'm not Daisy. That's Daisy.
That's why you have your name on your shirt.
That's
so
why
we
I
can all remember.
don't.
Oh,
Some
not on
of my
that one.
newer ones.
But we are a 3-on-6 office.
Yes.
So,
Exclusively 3-on-6.
and what does that mean?
We only do 3-on-6.
Do we do crowns?
Nope.
Do we do veneers?
Nope.
Do we do fillings?
Nope.
Do we do cleanings?
Nope.
Or
I
we
mean,
clean
cleaning's on
3-on-6,
3-on-6.
3-on-6s?
That's different.
Do we do single tooth extractions?
No.
No. We don't do any real general dentistry. We just do 3-on-6.
I just said I need to call Dr. Ben Emmett's office
because you have a toothache.
because I need to. Yeah, I need.
That's
I need
so sad.
something done. I'm not 100% sure. I'm trying to. I should go today after I take my Valium for my MRI.
Yeah, that's totally what we should
I'll
do.
just like show up.
And we're doing it today at 10 o'clock because we
I
usually
don't
do
have an
noon,
MRI.
but
Yeah.
today we are at 10 o'clock because Tiffany has a doctor's appointment this afternoon. And so we wanted to still include her in the live.
I like that you said it's a doctor's appointment. I have to go have an MRI of my low back and my pelvis, and it's not my favorite.
Yeah, she's been super excited about it. So I think we should just get started. There's so
Okay.
much information here. There's no way we're going to get through all of it. But
Today's topic.
is a complete guide to replacing missing teeth.
Know all your options.
Know all the options. So
I like
every-
this little thing they're printing off now.
every
It's
time a
really
patient
helpful.
comes into the office, we actually sit down and we show them all of their options.
Yes.
But I still get questions sometimes daily about what's the difference between a denture versus implants versus crowns versus bridge versus snappy denture versus a 3-on-6 versus an all-on-X, right? So some of these questions are a little complicated, but what we're going to do today is we're going to break it down so it's super simple so that you understand all the differences, and we're going to show some models. So pay attention to our voices today more than just trying to look at us, because I think we're going to scoot up closer to this other camera.
Yeah.
But you should probably do that now. Do you want to scoot up closer to that camera?
But we're going to start with not necessarily replacing a tooth, but fixing.
Yeah. So we're going to talk about everything in restorative. So we're going to start with the least
I'm gonna get real
invasive
close here.
thing. And the least invasive thing that you can do to a tooth is get a filling.
Yes.
And I think for the most part, people know what a dental filling is, right? We just get a filling. They remove
Take
the
out the decay.
yeah, they remove the bad part of the tooth, take out the decay, put in some synthetic material. Most commonly now it's white filling material. It's made out of composite. They zap it with a little light, it cures it, it sets it up, and then you have a filling in your tooth. So that's the most least invasive. And by default, that's also the most least expensive. So
Yes.
when we talk about dentistry, toothpaste and floss are pretty cheap. Then a filling is a little bit more expensive, and it kind of just goes up from there as we go down the list. So if we're talking about least invasive to most invasive, let's go with the next thing being a veneer.
Okay.
Okay. So a veneer, let's show a picture of what a
Should I
veneer would be.
show a picture here?
Yes, that's exactly right. Veneer. So a veneer is, sometimes we can do this trick where we don't even prep the tooth at all. And by prep, I mean touch it with a dental burr and remove some material. So there's,
This would be the veneer.
yeah, there's a thing called a
They're putting
no
on this
prep
tooth.
veneer. But most of the time we prep the teeth for veneers, and veneers leaves the whole natural tooth there. So it's your natural tooth behind, underneath, and below the veneer. And by definition, veneer just means we're replacing the front part of the tooth or maybe a little bit of the top of the tooth, but we're not covering the entire tooth.
Right.
Because if we cover the entire tooth, we call that a
Crown.
that's the next thing. So there is a crown.
That is
And-
so helpful that these are on the same page.
A crown can go most commonly on your natural tooth. So you can do a crown on an implant, and we're going to talk about that in a minute. But most crowns that we hear about, that you talk about, that your dentist is talking about, is just putting a full coverage crown. Most commonly in today's world, they're made out of zirconia.
Yes.
But they can be made out of porcelain. They can be made out of porcelain fused to metal. They can be made out of not pure gold, but they can be gold crowns.
Yes.
They can be made out of,
Yeah, it's probably the least common.
yeah,
one
least
now.
common.
Yeah.
Back in the day, gold crowns were really common. In today's market, they're not. Even then, they're like 22% gold. They're not pure gold.
Yeah.
They're an alloy.
Yeah.
Pure gold is just simply too soft, but they're gold colored, some of them. But most of what's happening in today's market is
zirconia.
zirconia or printed.
Oh yeah.
So there's a lot of people getting their definitive or permanent crowns now that are just
That are
printed out of
printed.
resin.
Yeah.
So they're super strong and they look really great. So those are your kind of most least invasive things. Now, we mentioned that you can put we didn't talk about a bridge. We show them a model of a bridge.
Yes. This might be kind of a trick to get it to stay in
I
there.
think you can do it. I have
Yeah.
faith. You gotta have faith.
Where did the camera go? There it is.
Way
It's
over
up
there.
here.
So that would be a
A
bridge on
on-
natural teeth. So lift the bridge piece off. And the bridge piece theoretically is just replacing,
Grab that there.
like say you had that tooth in the middle extracted. They could prep down the other two sides of it
Let's do.
and give you a bridge. So now you have a piece that is glued or otherwise retained onto those natural teeth. And now you have replaced the missing tooth that was extracted. So that's next option is a bridge.
A bridge on natural teeth.
Yeah, bridge on natural teeth.
Got these in backwards or something.
No, that's all right. So then that kind of covers your like glued in restorative options,
I would call those your basic options.
basic
Those are
options.
your basic options.
Yeah. So another option, show them the bridge model again. Another option for this is, let's say that you had that tooth in the middle extracted. You could just get an
An implant.
implant put right down into that spot.
Doo-doo-doo.
So why is there black and silver on that implant, Tiffany?
So
Will you
this,
show
the
the
black
difference?
piece. I'll take that off. The black. These are magnetic. They really want to stick together. The black piece is the implant. This would be the implant right here. It's obviously not this big. This would be for like a horse. It's a big implant. The implant. This is the abutment. The abutment. So the implant screws down into the bone. The abutment screws down into the implant. Put that back in. Do, 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 do. And then we can't find our little single crown. I don't know where it went, but it would be a crown on the abutment on the implant.
So you can just get a single crown
Single,
put
yeah,
onto the implant.
single implant.
Okay. All right. So now
Moving
let's
up.
move up. Let's say that a person ended up missing or having extracted a series of teeth,
Multiple teeth.
in a row.
Okay.
Then you might hear the word partial.
Yes.
And partial is kind of a slang term for partial denture. And it's called a partial denture because it's just part of a denture.
Yes.
So let's show that model.
So this
This is
the-
actually one of our patients
Yeah.
from before.
from a long time ago. He had his front teeth removed. He actually had his front teeth removed on the upper and lower. But this is the model. He had these 4 teeth removed.
Yep.
4 teeth removed. This is what we made him as a temporary fix. This was a temporary fix for
For him.
For him.
But for a lot of people,
For a lot of people,
this is permanent.
yeah. Our patient who had surgery this week had an upper and lower upper partial for decades.
Yeah.
Long time. So, and then it just snaps on to the existing teeth. And now when he talks and he smiles and he does all the things, he has teeth there.
Yeah. And so this is a metal framework partial, which means
Yes.
the teeth are acrylic,
Mhm.
but they are
Plastic.
attached to that metal framework. You'll notice how big the metal framework is.
Yes.
It kind of goes back, it covers up some of the palate, and it snaps onto the teeth around it. And that's what causes the retention so that it stays in place while the patient talks and chews and goes through life. But this prosthetic is required to come out every night.
Yes.
And you have to take it out. You got to clean it. You need to clean your gum tissue and clean your teeth. So there's a little bit of daily involvement with this type of thing. It's a put it in the morning,
This is the one.
go about your day, and then take it out at night.
And you can see if the assistant has a hard time. This is why I didn't want to look at that
Yeah,
one.
that one's kind of
The
stuck on
hard
there.
one is, or the bottom one is really.
So they should have pretty good retention. Like
Yeah.
the stronger it's held onto the teeth, the better it is for the patient to
And we'll
talk
say
and chew.
we made this for a patient. He never needed this one. Just FYI.
Yeah, so it's never.
It
been
hasn't
the
been in its
patient.
mouth. I'm not sitting here touching it after it's been in its mouth. That'd be yucky. So yeah, that would be a partial. I think as far as like cost effective, people choose these because they can be kind of cost effective.
But there's some requirements because
Yes.
the adjacent teeth, which means the teeth next to the missing teeth,
Yes,
have to be very stable.
these guys right here have got to be healthy and strong because you're going to be snapping that in and out a couple times a day, and they've got to be able to withstand that.
Yeah.
Take it out to eat.
No, you can eat
No,
with
you
it
can
in.
eat with it
Yeah,
in.
so good
Yeah.
question. So one that's made properly, you should be able to eat with it.
Yeah. Yep.
Okay.
It's not uncommon to get, things stuck up underneath it, things like that, but better than not having teeth.
Yeah. So if this is a partial denture, what's a full
Yes.
denture?
Full denture would be replacing all of the teeth on top or bottom. Dr. Emett was nice enough to print me one of these so I could show patients this option.
Yeah, we made that one here at the office.
Yes.
On our
It's actually
printer.
On our printer.
We
Yeah.
can actually print a denture. That's
Yeah.
wild.
So again, this was for a patient from a long time ago. It has never been in her mouth. That's why I'm pitching it.
Well, I printed it the other day.
Yeah.
Okay, so what are the advantages of a denture? Let's talk about the advantages for someone.
You want me to talk about advantage?
Yes, I can do it.
Cost effective,
Okay.
and it replaces all of your teeth. So you're not walking around without teeth.
And they look pretty good.
Yeah, they do look pretty
They don't
good.
look terrible.
And the upper denture stays in place pretty good. Upper dentures I think dentures as a whole get a kind of a bad rap, but upper dentures, patients come in with their upper dentures all the time that they've had for decades, and they've done really, really good with it. They just want a better option now. It's the
Yeah.
lower denture. Bailey, will you hand me the other model that's underneath my computer?
So,
This is actually a snap.
well, let's not get to that one yet. I don't
I'm
want
just
to
gonna take
get it
that
ready.
one.
Okay, so with an upper denture, we've talked about the advantages. They can be pretty cost effective. They can look decent. When you take out all of someone's teeth, they can go like to having teeth the same day.
Mhm.
We can take out all their teeth. We can give them
Give them a denture.
an interim denture, and it looks okay and it feels good. So the downsides to a denture are this big piece here. This covers up the entire palate.
Yes.
That's
it goes pretty
required
far back.
because that's what creates the retention
Yes.
so that the denture stays in place. But by default, it covers up your palate. And
Yes.
that creates kind of a big space above your tongue. So it really can affect your phonetics or the way that you speak. It also will make your food taste dramatically less exciting.
Lots of people don't know that you have taste buds. You have taste receptors on the roof of your mouth.
That's correct.
So it'll change that. It'll also change how textures.
So you can't
You
feel
can't
your
feel your
food
food the
brushing
same
against the
way.
roof of your mouth.
Yep.
So oftentimes when a patient comes in with a denture, their big complaints are they flop around, it falls out.
Mhm.
I'm afraid if I laughed hard or I took a bite of my food, my teeth wobble. There's a lot of self-consciousness issues with the denture, but then they all say, and my food just doesn't taste good. I can't feel
Yeah.
my food in my mouth. I hear patients say things like, it's like wearing a size 13 shoe on a size 8 foot.
Yeah.
You just feel like you've got a big thing inside of your mouth. Now,
I feel like I have a flip flop in my mouth.
yeah, flip flop.
That was my favorite thing I've ever been told by a denture patient. I feel like I have a flip flop.
And we often see patients when they're like, yeah, I got my denture 8 months ago,
Yeah.
6 months ago,
6
a
months
year
A
ago,
year ago.
and I
Yeah.
just can't tolerate this thing
Yeah.
anymore.
I think that's the most common
Yeah, it's
patients that come in for
thinking it's going to be okay.
They're like, I tried, I can't.
Yeah.
I can't do it.
But they can be great for a lot of people. And
Yes.
I'm not trying to be a fear monger. I'm not trying to tell people dentures don't have their place. There are millions of people running around with dentures, and they're totally fine.
And you would never know.
You'd never know. The other thing to
they're
talk
all
about with
around.
dentures is the bottom denture. It's
Yes.
worth noting.
So this is the
Because
bottom denture.
all the time patients come into the office and they don't even have their bottom denture. They don't know where it is. They haven't worn it for years. Turn the bottom denture over.
Ignore the little.
Yeah, ignore the gold
Spots.
things for now. but the bottom denture has very minimal retention.
Yeah, because it can't cover where your tongue goes right here, right? Your tongue's going to be sitting right here.
Mhm.
It can't cover that up. So there's no place for it to suction to. All it can suction to is the little bit of ridge that you have on the bottom.
Yeah.
So
So
lower dentures,
lower dentures are
they're a
really
little
floppy.
floppy.
They
like we choose the same word.
they just
They're
don't stay in
floppy.
very good. People don't like them.
No.
But there are some alternatives with dentures. So
Yes.
let's say that a patient has dentures and they just can't tolerate the fact that they're flopping around anymore.
Yes.
One of the things that they can do is they can turn it into a snap-on
Yes.
or snappy denture.
An overdenture.
An overdenture is the right word for it.
So these two little pegs that you see there, those would be little implants. This model shows little teeny tiny implants. Most modern dental offices are placing much bigger implants for this. But
Yeah.
this model, I think, is from the 80s, if I'm being honest. I found it on eBay one day and it was super cool. But lower denture would snap in place. And now it can't move side to side. It can still move up and down a little bit.
Turn that sideways so they can see that
A little bit,
play
up
right
a,
there.
a little bit of up and down movement, but not side to side.
But
matter
not
what
as
I do,
bad.
It won't move side to side.
Now that shows a denture on 2 implants.
Yes.
You can do 4.
Can do 4 on snappy. Mhm.
Now, do we do snappy dentures on the top?
Not as often
come?
because the bone on top is much softer than the bone on the bottom. So the more times you snap that denture in and out, in and out, in and out on those implants, the bone will start to recede around the implants and eventually the implants will fail.
Sure
So,
can fail.
Yeah, the last time I'm trying to think, we have a patient that had an upper snappy denture, and I think by the time she saw us, she was down to 1
Yeah.
upper implant. The rest had come
It
out.
all come
It
out.
all failed and come out, but her lower still snapped right on.
Snapped in.
Yep.
So if you hear somebody mention, hey, there's a snappy denture or I want to get snap-ins, that's what they're talking about, is a denture that literally snaps on. Now, this is still removable, has to come out every night.
Still has to
Has
come
to
out
come
every
out,
night.
not an
Yeah.
option.
Yeah.
Not only that, but the little gaskets that are inside of the denture that are creating the retention on the implants
It's far away from me.
require maintenance.
These
So
are nice.
down inside of those little gold fittings, there's these little gaskets, and those have to be replaced every so often.
Yeah.
Can they last for 6 months or more? Yes,
Yeah.
but it's most common they're replaced about every 6 months.
When they can change the retention level. So
That's right.
they have easy, medium, real tight,
Real
tight.
tight. Right.
Yeah.
So those are your snappy denture options.
Mhm.
Okay. So real quick, just a reminder that this is live. So if you have any questions right now about how any of this stuff works, if you have questions about anything you're seeing, feel free to submit them. We have a whole bunch of pre-submitted questions we're going to talk about today. No, put it on your paper. Look how smart we're going to be.
Look how smart we're
So
gonna
here's
get it
a
off?
quick shameless plug. Please follow us on Instagram, Facebook, YouTube, TikTok. We'd love to see you there.
Reddit. Don't forget Reddit.
We're getting more and more followers every week, so we're excited about that.
I love Reddit. I was on Reddit this morning.
And if
I love
somebody
it.
wanted to schedule an appointment with us, how would they
Oh,
do that?
Please call the office at 702-710-9006.
We are so
Thank you.
technologically advanced here right now. This is really cool.
You can also visit our website at alloutdental.com and fill out a form, and the girls will get back to you on Monday for sure. For sure on Monday.
Okay, so the next question I want to talk about is if you come into the office and you have a denture,
Yes.
can you get a 3-on-6?
Yeah. We do that all the time.
If you come into the office and you have a snap-in denture, can you get a 3-on-6?
Absolutely. We do it all the time.
If you come into the office and you have a partial denture, can you still get a 3-on-6?
We did it on Wednesday. Sure can.
If you come into the office, you already have a few existing implants, can you get a 3-on-6?
Yes. Please be aware, we may not be able to use your existing implants.
Yeah.
Most of the time, they are not in the ideal place
Or
for
they're
a 3-on-6.
or are they the correct type or
Or they're
style
like
of implant?
weird little tiny implants.
Yeah.
Yeah. You took out 5 implants on the surgery.
That's right. This
on
Wednesday,
Wednesday.
I took out 5
Mhm.
implants.
They were
So
adorable.
they're teeny.
They were so cute.
So you can transition through these things. So
Yeah.
in dentistry, I do want to do the most conservative thing
Mhm.
first. If you just need a filling, we're not giving you full mouth reconstruction.
Yeah.
If you just need one tooth replaced, we're
Yeah.
not giving you full mouth
You
reconstruction.
need one crown.
If you need a crown, you're not getting full mouth reconstruction. We're going to do the most minimally invasive thing. But at some point, you may find yourself at a place in life where your teeth have failed you. They no longer are worth saving. What do we call that?
Terminal dentition.
And does that mean all my teeth are going to fall out next week?
No,
So what does terminal dentition mean?
they're no longer, the prognosis of saving them is no longer worth the time, effort, money, and so on.
Yeah, it's like
Yeah.
we could go do a really nice paint job on this car with a bad transmission and a bad engine.
Yeah.
It's not worth it.
Wow, it's going to look really pretty, but it's not going to.
It's not going to function.
Correct.
It's not going to be useful. So at some point, if you find yourself in a position where your teeth are failing on a general level,
Mhm.
maybe you're missing a bunch of teeth, maybe you have a lot of decayed, broken teeth, then you are looking at more of a full mouth reconstruction
Correct.
perspective. So when it comes to full mouth reconstruction, I want to start and try to give way more education today than is required, but I want to teach them about FP1 and FP2 and FP3.
Yeah.
And
Let's
there
do
seems
it.
to be really, really confusing in the world of full mouth reconstruction. So buckle up.
When you come in for your in-person consultation with Dr. Emmett, he goes over these a lot with our patients. I mean, every time a patient comes in, they get a lot of
A
education.
lot of education.
Because
I just want them to
there
know
shouldn't
what all the
be-
options are.
well, we don't want there to be confusion.
Yeah.
We don't want patients to leave here and not know that these are options. Right?
So from a textbook perspective, we have some terms and
Yes.
they're called FP1, FP2, and FP3. What is FP stand for?
Fixed prosthesis.
And what does fixed mean?
It's screwed onto implants. The patient,
Or cemented.
Or cemented. The patient cannot take them in and out at home.
Right.
And they're
It's
not required
permanent.
to take them in and out at home.
So by the definition of permanent, that just
Yes.
means that you don't take it in and out on your own. It's just
Yes.
not removable. It's
Correct.
fixed. So it's serviceable.
Yes.
Your dentist can unscrew these. Your dentist could remove the cement retained ones. Your dentist could do it, but these are fixed prosthetics.
Yes.
Okay.
Correct.
So FP1, that refers to, hold it up there so we can just zoom in on just FP1. Look at how the patient's teeth are tucked up into the patient's own gums and they're contoured around the teeth. That is an FP1. FP1 is standard size, normal size teeth that are tucked right up into your gums and look like they grew there. They look like they are the patient's own teeth.
Correct.
So if there's an FP1, what is FP2?
FP2.
FP2, again, is contoured up into the patient's gum tissue, but the teeth are slightly longer.
Mhm.
So we have slightly longer teeth, or maybe even a little bit of pink on the top of those teeth made out of ceramic or zirconia. But the
Mhm.
idea here is we still want to keep the patient's natural gum tissue. We want to keep
Mhm.
their natural contours and do no bone removal.
Correct.
We just want to make their teeth a little bit longer. And most of the time, the longer teeth are hidden above,
By your lip.
Your
and
lip.
yeah.
so they don't show when you smile.
We have a few patients in more of an FP2
Yeah,
style,
totally.
and we've only ever had one opt to do the pink along the gums.
Yeah, everybody just wants.
Everybody else is
Just
like
make my teeth white, make them a little bit longer.
It's fine. Also, something important to note: these two do not require removal for cleanings,
Good point.
because that
Okay.
was a big point with a patient we did a consultation
Just
with
yesterday.
Uh-huh. These do not require removal for your 6-month cleaning.
That's correct.
All right.
So if there's an FP1 and then there's FP2, there must be an FP3.
FP3.
So FP3, what does that mean? That means that you have flat planed the bone and you have fake gum tissue. Oftentimes longer teeth also,
Mhm.
but you also have fake gum tissue.
Yes.
So the patient no longer has their own gums.
Correct.
And that makes that big line there
Yes.
between the prosthetic and the bone and gum tissue in
gum
their mouth.
tissue. This one also is required to be removed for cleanings.
It should come out every 6 months.
Yes.
And depending on which literature you read and from when you read it,
Yes.
can they last for a year in between cleanings?
They can.
Potentially, but they get real stinky
They do.
and they
get
start to
kinda
taste
gunky.
pretty sour. They get kind of
They get gunky.
gunky is a good word for it.
Yeah.
So an FP,
We have pictures of these that did not come out often enough for cleaning.
oh,
They're
covered in
they're on
green
my
gunk.
phone. I'll show you, but they're pretty gnarly.
Okay, so on the model, will you please show the model of an FP3.
Yes. This is a P3.
I think that's a pretty good FP3.
It is a pretty good FP3.
Like, I'm not showing people like the weirdest one I've ever
No,
seen
no.
or a tough one. Like,
this is
that is an FP3.
Yeah. You can see that it's flat. So let's see if I can get it flat along the edge. This patient obviously had a little bit more bone loss on this side because it goes up a little bit higher there, but it's flat.
Yeah. So turn around to the front. This is the fake gum tissue.
Fake gums.
So somebody just asked, how much does it cost to clean an FP3? We don't do that
I
here.
would say I've heard anywhere from
Like 500 to
5
900.
to up to about 1,000.
Depending on your office, depending on who did it, where it was done. One of the challenges that we're hearing about just this week, patients are going to corporate offices where they do the FP3 surgery.
Mhm.
I'm not going to say their names because I'm not trying to throw anybody under the bus, but like big corporate full mouth reconstruction offices. Like maybe it rhymes with beer choice.
or Stuvia.
Or Stuvia. I don't know. I'm not going to say their name. But then the problem is they call 6 months later and say, hey, I want to get them clean. They go, oh, we don't do that here. You need to go see
a
your regular
general
dentist. And
Yeah.
general dentists right now are reluctant to take the case on and
Yeah.
do your cleanings because they don't know what screws you have and what instrument they need to have to do your work and how to do the fillings again. So there is kind of a disconnect right now with patients who need these serviced
Well, it takes,
and are having a hard time getting them taken care
It
of.
takes a lot of time. It seems like, oh yeah, you just drill it out and then take the screws out.
It's not that simple.
It's not that simple. It takes what screw is it? And then if
What
the
driver
screw
do you need? What if the screw is
what if
broken?
the screw is
And
stripped?
the
You
screws
have
should
to-
be replaced every time.
Yes.
So does the office have the screws that are going to fit into your
Yes.
implants?
Yeah.
So it gets pretty complicated when we're trying to deal with maintaining and servicing your all on X. Oh, FP3. Hold on. We got to back up a little bit. So we hear people say all the time, what is an all on 4 and what is an all on X?
Oh yeah.
So
An
cover
all-
up this side right here.
This is an all on 4 or an all on X.
So what's the difference between all on 4 and all on X?
All on 4 is technically owned and trademarked by Nobel Biocare. So they came out and they said, if you want to do an all on 4, you have to use our implants.
Okay.
And then doctors said, well, you don't want to use your implants, so we'll just do an all on X.
So X could be any number.
4, 6, 8, 100. It doesn't matter. It's an all on. All of your teeth are on X amount of implants.
And you have fake gums.
And you have fake gums.
And there's a certain number of implants underneath. So
Yeah.
if your office says, oh, we do all on X,
it's an all on 4.
that's an all on 4. It's an all on X.
Yes.
Those terms are unfortunately now pretty much universal.
Yes.
Versus,
And they're completely interchangeable. I don't know any offices that are like, we do the true all on 4. Most are
people
like,
just say they do all on X
all on
now.
X. Yeah.
Versus
These two guys.
3 on 6. So what is a 3 on 6?
These two guys.
That
I think it's
is
centered.
a
It just doesn't look like it on our screen.
FP1, FP2.
Correct.
Now, 3 on 6 goes one step further, and they're actually a modified FP1 because of 3 on 6, we're technically giving you 3 separate bridges in your final prosthetic.
Yes.
But it is a FP1
Correct.
where you
No
keep
fake
your
gums.
gums.
Right.
Okay. Somebody just asked, what about the cost of FP1 regular cleaning at your office every 6 months?
Yeah.
Good question. So for an FP1 at my office in Las Vegas, keep in mind this is just as it pertains to Las Vegas. At my office, we charge $150 every 6 months.
That includes your exam, your panoramic x-ray, and a CT x-ray if Dr. Emmett says,
If you needed
I
it.
want a CT of that, which I don't know if I've ever taken a CT on a 6-month
I don't
clinic
think
yet.
we ever have.
And the cleaning itself.
Yeah.
So
that's the full exam, x-rays, cleaning. So yeah, for an FP1 and an FP2, your yearly maintenance will be in the $300 to $500 range,
Yeah.
probably.
Yeah.
At my office, it'd be $300.
and because we're not taking the teeth out, you don't have the cost of replacing screws
Right.
or possibly abutments or anything else. They're there. And if you are missing one of the little fillings on top of the screw, we'll just throw it back in. It's not,
Yeah, that's included.
not a big deal.
It's not a profit center for us.
No,
I don't know who's out there making money cleaning FP1s.
no. We're just making
Because the other
sure
thing
they
is,
are.
they stay so clean.
They say so clean.
So
yeah, they say so.
It's
so
not
clean.
like an FP3 where the underside of it gets covered in gunk and you have to
No.
put it in a machine and clean it off. It's not like that. They just stay clean.
I think the longest
So, yeah,
cleaning
good
was
question.
like 45 minutes. It was mostly because we were just chatting with the
Yeah.
patient.
Mostly
We're
it's just a chance to
we're
come
just
hang out
talking.
and chat and catch up.
Yeah, the most important part of that is the panoramic X-ray, so that Dr. Emmett can check the bone levels around the implants.
Yeah.
And then just a quick look and make sure, because you also do like an oral cancer
Yeah,
screening.
oral
and things
cancer
like
screening.
that.
We just
Make
check
sure
everything.
that
I do a full
everything-
exam.
Yeah, make sure everything looks good in your mouth, not just with your implants.
Yeah, good job. Okay, good question, buddy. 88883.
888.
I can barely read it from
I like
here.
buddy.
All right. Okay,
Sweet.
so that is if you hear the term, I'm getting a 3-on-6, and they're like, well, how's a 3-on-6 different than an all on X? Now you know.
Yes.
A 3-on-6 is an FP1 with you keeping your gums, and all on X is where you get the big fake gum line.
Correct.
That's high level differences.
There you go.
Okay, so now we showed an all on X, an actual one
Yep.
right
All
there.
on X. That's an
So
actual all on X.
Now I want you to show an actual 3-on-6.
Do you want it on the
I'll do
model?
this one because then it's comparable.
This
easier.
is a 3-on-6. This is a temporary. This is a 3-on-6 temporary. Isn't it cute?
Look at the dramatic difference.
Look at it. It's just teeth.
So no longer do we have the big fake gum line. We have teeth that are just the size of teeth. Now, these teeth are still made out of zirconia.
Yes.
And
your
so that
finals are still made
your
of
finals are
zirconia.
still in zirconia.
Mhm.
They are much thinner in the width when you have a 3-on-6,
Yeah.
an FP1.
I'm going to show you the comparison here in just a second.
Yeah. But one thing, just for technicality, I should bring it up. Guys, these are, when we say on, like 3-on-6 implants.
6 implants.
All on X, the X is the number of implants. So
Where those little holes are. If I can get them. Let's see.
that was pretty close.
It's pretty good, right?
Those
Those
were
are
the
where the
screws.
implants would be.
Yeah, that's where a screw goes down and screws it onto the actual implant.
I think it's important because you already mentioned it, the width. So look at this. This is just the width of teeth. No weird, crazy stuff on your palate. This is the width of an all on X. And this is a very thin all on X.
Yeah, we should get a more
I
representable.
know.
I
I've
just don't want to ever.
I've thought about it, but I was like,
I have some pictures on my phone that
I've
will blow your
got
mind.
pictures, but this is much, much thicker. Much, much, much thicker.
If Bailey tells me to smile one more time,
I know,
I'm gonna
she just
get in
keeps
so much
pointing at
trouble.
you.
I get like RBF during these things.
You keep sitting down, like folding your arms.
I get
like
so
you're-
focused, so that I just
like
sat
you're
up and
gonna-
smiled real big, and Bailey can't get it now. All right. So, okay, show this model now that
Okay,
shows a
So
3-on-6.
this would be a 3-on-6 final. It is on the model. I do have another one over there. That's just the teeth.
Oh yeah, hand that
Yeah,
one over here too.
I actually, so this is the 3-on-6 model that there that the Smile Systems sends out to their providers to show patients. I love the model. I think they're stunning. I think they're very, very white.
Yeah, they're really white.
So,
That's okay.
but it does show 3 bridges. There's 1 bridge. There's 2 bridge. There's 3 bridge. And in your finals, it's very important. These get covered up.
Yeah, we
you
just
won't see those.
leave them covered here so you can see how it works.
Yeah, when we leave them uncovered in your temporaries because we're going to take your temporaries out in 4 months.
Now,
So
if this is a standard traditional 3-on-6,
this is a standard traditional.
is there a
3-on-6.
world that exists where my 3-on-6 might only be 2 bridges?
Yes.
Can you show me a model of that?
I'll show you. This is a set of finals that I ordered 2 of for a patient because I loved how they looked. So this is 2 bridges. You can see where the holes are.
And how come this person got 2 bridges instead of 3?
She wanted what was called a midline split right there, right down the midline. She said, I think that'll look more natural. Dr. Emett said, great, let's do it.
Plus,
Okay.
it has to do with the implant placement.
Yes.
So
Yep. Implant placement.
where the available bone is will dictate sometimes where we can place implants. So our goal is to get you 3 bridges, but sometimes we get just 2. Tiffany, is there a world that exists where a patient may have a 3-on-6 FP1 and have 1 bridge?
Yes.
They may have a 1-on-6.
Yes. So there we have some patients who want extra molars back here, but they don't have the bone far enough back to put an implant far enough
Far enough back.
back. There we go. So Dr. Emett will keep them in a single arch, kind of like this one. Keep them in a single arch, but will extend back a tooth so that they have an extra molar. Just
So
like that.
a lot of things go into planning your case
Lots of things.
to make sure that it's as stable long term.
Yes.
But you can be in a 3-on-6, a genuine, authentic 3-on-6, and have 3 bridges.
2 bridges.
You hold on, you got 4 bridges,
4 bridges.
3 bridges, 2 bridges, and 1 bridge.
Yes.
What I don't want you to get hung up on is the number of bridges, not even the number of implants.
Yeah.
But what I want you to get hung up on the thing that should matter to you the most is keeping your gums.
Mhm.
I want you to be hung up on, I want my teeth to look as natural as possible and not have that big fake line.
I want my gums and I want my bone to be left alone.
Yeah, that's
Don't-
exactly right.
Don't remove it.
Okay.
Don't remove it.
So we now have talked about all restorative options from the very beginning, from doing a filling all the way up through having full mouth reconstruction.
Yes.
I want to talk now about how many patients get one arch versus both arches done at the same time,
Yes.
and why. So in the last 3 years, how many patients have we given one arch to?
6.
6 total.
Mhm.
Why?
So it's interesting. I think people are like, oh, they only wanted to replace their upper teeth. We've actually done
Probably
almost 3 and 3.
Yeah, more
it's
lower.
4 and 2, but lower arch was not healthy. A lot of missing teeth, a lot of decay, so you replaced just the lower. His upper teeth were great. His
Yeah.
upper teeth were totally fine.
Which is totally fine.
So you only replaced just the single arch, and vice versa. The upper teeth were the problem. The lower teeth were totally fine. There was nothing going on with them. They
So
might have needed a filling.
all the time patients come to the office and they say, I'm just thinking about getting just my upper.
Yeah.
Because that's the one that you can see when I smile.
Yeah.
But the reason that we can't just go around giving everybody just upper teeth is whenever we do one arch, I'm going to give you super strong teeth on that one arch. And if your teeth across from it, your bottom teeth, aren't healthy enough to support that one arch, it will accelerate the breakdown of your bottom teeth. So all of a sudden you might have really pretty upper teeth for 6 months or a year, but that zirconia will break down your bottom teeth faster.
Yeah.
Not only that, oftentimes people's bottom teeth are doing this kind of thing.
Yeah, the roller coaster.
So if I make you have beautiful upper teeth, they're not going to be cosmetically ideal because they still have to match your bottom teeth so you can chew. Not only that,
You want patients to be able to chew. That is so nice of you.
now your top teeth are going to be beautiful and white-ish, or at least they're all a uniform color, and they won't match your bottom teeth. So your
Yeah.
bottom teeth are going to be wonky and full of fillings and misshaped. Another challenge we have is oftentimes patients are missing bottom teeth.
Yes.
So even if I give you really good top teeth and you don't have molars on the bottom, so you have nothing to chew on, you aren't able to utilize your new top teeth. And if I don't have full autonomy of where I can put your teeth on the ridge front to back,
because they have to line up.
because I have to match up with
there.
your wrong place of your bottom teeth, now I had to put your implants and your bridges on the top in the non-ideal location. So that when you come back to me in 2 years and say, oh my gosh, I want to do the lower, we are most likely going to have to redo your upper bridges, maybe even some implants on the top in order to balance out your bite and make it cosmetically ideal.
Yes. So if a patient
a
comes
lot.
to you and says, I only want my upper done, and it's purely financial, what do you tell them?
Listen, I was taught from a very young age, if it's worth doing right.
Mhm.
So I know there's providers and there's offices out there like, yeah, let's just do the top. We'll get it done now. And in a few years, we'll do the lower. Just save up. Most time, the reason it's financial. Like, hey, I just can't afford to do the top right, or I can't afford to do both at the same time right now.
Right.
As long as we're not in pain, as long as we're not having detrimental
Major
things
infection
happen,
and things like that.
then just wait. We're not selling used cars. I'm not trying to push you into doing something that's not right for you at the time. Let's just wait and come back, because if it's worth doing, it's worth doing right. So let's
Well, and
not
we've had-
rush in to do something if we're not doing the right thing.
We've had patients that were like, I want to do, I totally understand. I want to do them together. And they came back a year later. They
2
came back
years later.
2 years later.
I got a text
and-
message over Christmas break.
Yeah.
I've been saving up and I got some money for Christmas and I'm ready. And it was
Yeah.
years ago that we met the patient.
Yeah. So it just wait, just hang on, just do it right. Plus,
Yeah.
and it's one surgery. One surgery.
One surgery,
you
one
heal
recovery.
once. You only, yeah.
And then the
You have to wonder
outcome is
once.
ideal for your situation, as opposed to continuing on this pathway of being in the dentist all the time, Mickey Mousing things together, just band-aiding things together.
Yeah.
When in reality, you should just get it done the right way one time. So I do say that to patients all the time. Wait, I thought we needed to get things fixed so I have bone.
That's one of the
Ugh.
things that's a little bit different. If you have active infection going on, that the
Yeah.
infection in the tooth that's causing the infection needs to be addressed.
Sometimes your unique situation might mean that we need to act more proactively and stop active infection and stop the bone loss and preserve what little bone you have. And that may be a really important consideration for every patient.
That doesn't
So-
always mean take them all out. And
Yeah, that doesn't always
yeah.
mean let's rush you right in
Mhm.
to do an upper 3-on-6
We have a
if
patient.
it's not the right thing.
We have a patient who is very active on social media,
Okay.
who was in that boat. She wasn't ready to move forward just quite yet, but her lower teeth were causing some major bone loss. And so we took those out before she was ready for her 3-on-6
That's true.
surgery. She's now in her temporaries.
Yeah.
She's coming in, I think, next month.
Oh my gosh, I'm so excited
That's
for her.
so exciting. I think it is next month.
Yeah, that's coming
Yeah.
up.
So
Okay.
that's a
So-
good point, Mia. That's a very good question.
Yeah.
So make sure that during your consultation you have all those all those questions, and make sure you get your answers.
Okay. So the 3-on-6 is not removable by the patient,
Correct.
but it's removable by us. And have we ever, let's see, let's answer this question. Do you do 3-on-6 plus? How much better is it compared to the regular 3-on-6? Listen, buddy, good question. Yes, we do the 3-on-6 plus.
Yes.
3-on-6 plus is an extra set of implants so that we can get a little bit further back. If the patient has adequate arch space, adequate opening, and adequate bone, they may be a candidate for a 3-on-6 plus.
Mhm.
The 3-on-6 plus, we have a whole episode we did about this
Yes.
not that long ago. There's videos on the website
Yep.
about a month and a half ago, I guess. The 3-on-6 plus is not for everybody,
Correct.
but if you have a big, wide, broad arch, big, broad smile, lots of space in your mouth, adding some extra implants and another tooth, some more chewing surface can be beneficial. So to just say how much better is it, it's more of a unique case-by-case
Yeah.
situation. It's not that it's necessarily better. In fact, for some people, it's not even possible.
Right.
And I would be reluctant to use the word better. I would be confident using the word,
I mean, they're
what should I say for that? For somebody, if you are a candidate for a 3-on-6 plus, and you-
comparable is the wrong word too. They're the same.
yeah,
like they're-
the outcome for the patient is still ideal.
Yeah.
The outcome for the patient will still be totally great. But if
Yep.
you have enough space for it, and if your provider recommends that you do a plus, you should highly consider it.
Yeah.
Because it's going to increase your chewing surface by another tooth.
Yeah.
So I wouldn't say that we could use the word that it's better than a traditional 3-on-6, because I've done only a handful of 3-on-6 pluses.
Mhm.
And the patients that have it, if they did or didn't, they probably wouldn't know the difference.
Yeah. Yep.
Sorry. That's just
Yeah.
the truth.
And so
I'm
for
not a
those
very
of
good
you that
sales guy
don't
trying to
know
sell more stuff.
what a 3-on-6 plus is, there are 8 implants on top, 8 implants on bottom. Traditionally, you would have 4 bridges on those 8 implants, top and bottom.
Yeah.
There is a cost difference.
Yeah, it's about $10,000 more.
Yeah, there is a cost difference.
I mean, it's just the lab fee alone.
Yeah.
So yeah, it's more expensive to do that. That shouldn't be your determining factor, but it's not even possible for a lot of patients.
Yeah, at our office, the patients who are eligible for a 3-on-6 plus, they get a treatment plan for both options.
Yeah.
They ask, well, how far back will my teeth go? And Dr. Emmett's like, well, about this far back. They're like, oh, I don't even use those teeth right now. Oh, I don't even have
I
those.
haven't
I
had
haven't
those
had them
teeth for 20 years.
I don't need them now.
So
All right.
yeah,
So,
but yeah, there's an added cost for that.
Yes.
I got drilled. Oh, I wanted to go over questions. So if you guys are live, you're watching this right now, I appreciate Buddy and Mia for asking questions, but feel free to chime in right now with your questions. We'd be happy to take those. But we're going to start going down the list of questions now that were pre-submitted for these.
Are you done with model?
Yeah, we can be done with model. Well, no, because what if we still show them?
Just
I like having it
Yeah,
because
we'll have 'em on
usually
there.
we put our hand behind it. It's not as good.
So this guy right there.
Okay. How much does a partial denture cost?
The last time we did one in our office,
Just call it
honestly, I
$1,000.
think we charged $1,500 for these.
Call it
I
$1,500.
think this one was $1,500 for the top, $1,500 for the bottom.
Again, we don't do that here.
I was gonna say we
So
also
I'm a
we-
bad one to ask for costs for stuff that is not a 3-on-6.
Yeah, we also even with this patient, we did like an all-inclusive type thing.
Right.
I
This
can
was
really
an
break
interim
it down.
stage. This
Yeah,
was to get him to the next
yeah.
spot.
This was also done a long time ago. So
Yeah.
the fact that we still had these was really cool. When Amelia the other day was like, "Yeah, we still have these partials," I was like,
Yeah.
"How? Like, how do he's in Bridges? What are we doing?" So I'm glad that we had them.
What are the different materials that you can use, or what are the different materials implants are made out of?
Titanium.
So 99% of all implants are titanium.
Yes.
What is the other 1%?
Zirconia.
Zirconia. I don't place zirconia implants. I know a provider who has done a handful. In fact, I have a patient that I see in Las Vegas that had zirconia implants
done.
and I just do her maintenance for her cleanings. And they look great.
Yeah.
But it was very technique sensitive.
Yes.
And she's had some issues with getting the bridges hooked down because the zirconia implants are not screw retained. They're cement retained. So the bridges that I put on my implants, I screw them down so I can unscrew it if I had to. But the other bridges on zirconia are cemented on. So when you're cementing it on, if it's not perfect, there's challenges. And if you ever had to take it off, there's major challenges.
Yeah.
So
Yeah. I worked for a doctor many years ago that placed zirconia implants kind of when they were not brand new, but newer.
kind of first coming out.
And they were, and patients were kind of getting on this idea that they were somehow healthier for you. Not, but he placed one and he started placing it and it fractured and he was like, oh, so we had to take it out. And it was like taking out piece by piece.
It's just like
And
totally
he's like, okay,
shattered.
The whole thing just fractured right in half.
Oh, wow.
And he's like putting in another one and the exact same thing happened. And unfortunately the patient's asleep. So it's not, and so he just like kind of looked up at me across and he's like, I was like, you said you'd do it. I'm not, I'm just the assistant, bro.
I've never placed one, so I don't have a lot of valuable information I can provide.
They've gotten a lot better since then, but yeah, they do have a higher fracture.
They for sure have a reputation.
Yes.
Okay.
I also think it's important if your titanium implants, they are medical grade titanium, same as
Good
a
point.
hip replacement, a shoulder replacement, a knee replacement. They are medical grade titanium. It's not an alloy. It's not mixed in with all these other metals. So the chances and likelihood of you being allergic to titanium is like 1 in a trillion chance. It's so small.
Is there a reliable test that you can have performed to find out if you are even allergic to titanium?
No.
Why not?
Because
It's
because
useless.
there's so many things that can also be allergic to that it's not reliable. They don't even have that test in the United States.
Right.
We found out.
They have it's called a Melissa or a Melissa.
Called the Melissa
test.
Yeah. And you have to send I think full blood work to a lab
Europe.
in like Switzerland or something. And we're like, we're not doing that.
So the likelihood of actually being allergic to medical grade titanium is so low that there's not even reliable testing avenues to have it tested.
And people will get the titanium bracelets off of Amazon and wear them. Be like, see, look, I'm having it. And they're like, then you look up that bracelet. You're like, it has nickel in it.
Yeah.
You're allergic to nickel.
It's
You're
not
allergic
medical
to
grade titanium.
Yes.
Okay. Have we ever removed a permanent 3-on-6 bridge, a final 3-on-6 bridge?
Yeah. We've taken them out.
So they are serviceable.
Yeah.
I've had plenty of times where we've had to take off somebody's bridge to find out what's going on. Oftentimes it's some discomfort or we've got something going on. So they are serviceable. We can take them off and clean them. But do we take them off at everybody's cleanings?
No.
No.
We've never had to do that.
We've never had to take them off to clean somebody's teeth, but we can take them off. What happens on the bottom side of a 3-on-6?
Ooh, we want your gum tissue to attach to the zirconia.
And it does,
And
you
it
guys.
does.
It
Yes,
attaches.
It attaches.
And that's what keeps the food and debris and
Yes.
bacteria out of there, is because your gums are literally attaching onto the zirconia itself. So we don't break that attachment when we're cleaning your teeth.
I think Dr. Roberts has a video where he's got the screws out, but the bridge is still in place.
And they can barely take the
and he
bridge
can
off.
barely take the bridge off because the patient's gum tissue is
And we've
so attached.
for
to
sure
it.
witnessed that.
Yeah.
We for sure see
we've had
that.
that happen
all
in
the
our
time.
office a lot, especially with the temporaries. If you come in for your 4-month healing check appointment and Dr. Emett struggles to get your not struggles, but struggles to get the
bridge off.
He's really strong. He can do it, I promise. But to get the bridge off after the screws are out, I get so excited.
Yeah,
'cause
that
I'm
means
like,
your gums
that
are so
attachment
healthy.
is going to be so
healthy.
awesome. Yes, it's good things. Good things.
Do you floss around zirconia bridges?
No.
Why do we floss between teeth? Why is your dentist telling you to floss your teeth?
Because you have enamel, and enamel can get bacteria and food and all kinds of, so you floss it to keep it clean in between your teeth.
Yeah, and one of the common places to get cavities is right in between teeth where they're touching. So your toothbrush bristles can't get in there.
No.
Even your water pick can't get in there. You need to put floss in there for mechanical debridement, so it can
down
go
one side, up the
yeah,
other,
so it can go
down.
clean the inside of your natural teeth. But if you're in zirconia bridges, you don't need to floss. Now, if you have segmented bridges, let's say you have 3 bridges, that means there's 2 places in your mouth you can floss.
Yeah.
So if you were biting into some beef jerky and you got a chunk of food stuck between the bridges,
Floss it out.
floss it out. Like that's fine. But you don't floss your zirconia bridges. You don't floss your 3
That
on
was
6.
actually one of the reasons why we had to take a bridge off for a patient.
That's
Is because he flossed. He was determined to floss, and he got floss stuck between his bridges.
wound up underneath of there and like shredded and just a clunk of floss. And he
I was like,
sent 10 rescue flosses in there to try to get it and couldn't get it out.
we
So,
had so much floss we had to take
so
out.
we just undid it and took the floss out.
Yeah.
It's like sending a rescue chip into the dip. We just kept
it's
sending
just gonna keep breaking.
rescue floss
It's
and
gonna
try to
keep
floss it out.
breaking. We're making Bailey laugh. She's over here coughing. Sorry, Bay.
Okay, we only have 10 minutes left. Our goal today was to talk about all the things, all the options you have when you're considering full mouth reconstruction. So if you're live on this event, ask your questions now. There's only 10 minutes left. We are going to keep going down our questions we have here. But if somebody wanted to come see us for an appointment, first off, where do most of our patients come from?
Social media.
Yeah.
Lots of our patients find us on social media from across the country.
So what percentage of our patients would you say are actually in Las Vegas, Nevada?
15
Tops.
Literally 85% of our patients fly in to see you.
Yeah.
I know it doesn't look like you can see it on there, but you can.
That's close enough.
Yeah, you can. Just like I look like I'm cut out.
Okay, I'll quit messing with it.
So
Okay.
So
So
find us on social media, Instagram, Facebook, TikTok, YouTube, and Reddit. We're kind of more brand newer on Reddit, but it's been really
we have like
fun.
9 followers now.
I know. Yeah,
That's
it's
a
really
big deal.
fun. I'm enjoying the Reddit thing.
That's
But
hilarious.
if you wanted to come and see us, even if you don't live in Nevada, that's totally fine. We'll start you off with a virtual consultation.
Okay, talk about that. What's a virtual
Oh,
consultation?
I love virtual consultations. We did so many virtual consultations this week.
Lots this week.
Call the office 702-710-9006. Like again, regardless of where you live, and we'll get you set up with a virtual consultation. On those consultations, I chat with you for a couple minutes. I basically am just like, I just gather information.
You go over all the same stuff,
I
though.
go
You
over all
show the
same
differences
stuff.
and all the
Yeah,
options.
I go over all the same stuff. But I would say I do that less on virtual consultations. For some reason, our virtual consultation patients are so educated. I feel like they could tell me
They're
about them.
already
And some
well
of them
ahead.
do. Some of them like, yeah, so I know I have to do like, yes, my soft food diet. I'm on that all 4 months, right? And I'm like, this is awesome. Yeah. This is great. So we just kind of start you off. You chat with me for a few minutes. I go over your health history very briefly. Just make sure that there's nothing that Dr. Emett needs to talk to you about. And then Dr. Emett comes in and chats with you and goes over any clinical questions that you have as far as surgery and things like that.
What's my goal with the virtual consultation?
Just to make sure that we all like each other.
No, I mean,
Make
that's
sure the
important.
patient likes
I like
us.
that too. But my goal is to decide if it's a smart decision for you to fly out to see us in Las
Yes.
Vegas. That's my whole goal.
Yeah.
If we decide to move forward,
Which it always is.
Yeah.
It's always a good idea.
I want to minimize your travel time and maximize what we do when you're here.
Yes.
So we don't want to fly you out for a consultation and then fly you home and then you fly back out for a records appointment and smile design session and then fly home and fly back for surgery. So let's have you come out one time. Let's do your consultation and your records on the same day. So
Yes.
during the virtual consultation, we're going to give you your custom treatment plan.
Yeah.
We're going to give you all of that information so you can make a decision about whether or not you want to come out and see us.
Yeah.
All right.
I
So
still
that's
think
my
it's
goal.
important that you like us. Because if
It's
you don't like
important.
us on the virtual, guess what?
That's who we are. So
That's who we are.
tough. Okay, so that's how they can come out and see us. Let's.
Oh, I had a patient ask. They said, "Well, I don't have an X-ray." That's okay.
Oh yeah, that doesn't matter.
It's okay if you don't have an X-ray. When you come into Vegas, we're gonna take our own X-rays anyway. We had a patient that was like trying to get into an office to get an X-ray taken so that she could send it to us. And don't go to all that trouble. It's okay. It's all right. Just come see us.
Just
come see us.
All right. If I already have implants,
Yes,
can I still get a 3-on-6?
absolutely.
All right. Kind of talked about that earlier.
Yeah, talked about it.
If your
earlier.
implants are in a good position, if they're stable,
Mhm.
healthy, and they're serviceable, meaning they're a modern type implant with available parts and attachments, yeah, let's use it.
I say we've had patients that we've used their existing implants.
Yeah,
in
But
the
most of
past.
the time,
Most of the time they're
we're
not.
just going to take it
They're
out.
not helpful.
They're
Yeah.
usually just in the wrong spot, or there's little teeny dinky little implants that
Yeah.
aren't going to be good for you.
Or they were placed not awesomely, and there was room for improvement on
Yeah,
the placement.
That's how I say it, room for improvement. Can I go from a all on X to a 3-on-6?
Kind of.
Oh, you guys, that's such a loaded question.
We have a patient coming next week that we did a virtual consultation with. Nope,
Yeah.
2 weeks from now. That we did a virtual consultation with that's in an all on X that would like to go be converted to a 3-on-6. And even if you can't get her to the most perfect 3-on-6, there's so much room for improvement on what she's currently
Yeah, what's in her mouth right now is so thick and
Very, very
bulky. She
thick.
can barely speak.
Yeah.
So we've done it.
Yeah.
We have successfully. I
Yes.
personally, yes, I have taken patients from a all on X
All on
to a
X.
3-on-6. I think my mentality towards that now is that there's almost always opportunity for improvement.
Yeah. With the teeth themselves.
Whether we just recontour the gums and we do some augmentation of the bone, maybe some soft tissue grafting, maybe we just do just a redesign of the teeth and make them thinner. And
Yes. Yeah.
I think there's almost always some room for improvement, but it comes at a cost. You've
Mhm.
already spent $50,000-$60,000 on your mouth, and we're having to redo most of that work.
Mhm.
But the patients we've done it for were in a position where they went, I can't live like this anymore.
Yeah.
So
I don't care how much it costs.
it doesn't,
I've gotta
it's not a
do
money
something.
thing. It's I can't live like this. So yes, it is theoretically possible to go backwards from a all on X to a 3-on-6. And we have another question from Buddy.
Do you supply calcium pills to patients, as some other providers do, to prevent bone loss? What are your opinions on those pills? They are kind of expensive. We get you started. We get you.
I
we
give
get
you your first
bottle.
bottle
Mhm.
of it. But yeah, I mean, the answer is yes. So anything that we can do to promote bone health and bone healing, especially for dental implants, is important. We see a lot of patients who have pretty low bone density.
Mhm.
And that's, implants need 3 things: bone height, bone width, and bone density.
Mhm.
So oftentimes, I almost always, unless it's contraindicated, will put a patient on a supplement to help with bone health.
It's got lots of vitamin D3 and calcium.
Yeah, vitamin D3 and calcium.
Almost everybody in the whole world is vitamin D3 deficient.
Yeah.
And they've linked vitamin D3 deficiency to implant.
Yeah. So
health.
there's actual
So-
literature now that says that,
Mhm. Vitamin D3.
yeah, D3 has impact on your implant health.
Yeah.
So the question is how much of it you should take and how often, and if that's an issue, because I know that people get some stomach trouble from it.
Yeah.
We've heard
We've heard
some
people
feedback about that.
Mhm.
So talk with your provider about that. There are reliable tests you can do to check your bone density,
Mhm.
and you can do a DEXA scan and find out how dense your bone is. The problem is it's not really necessarily specific to your mouth.
Yeah, it's a full body.
Yeah. But we can look at your x-rays and we can look at them and say, yeah, there's very minimal bone density. And for those patients, it's extremely important that they're doing everything they can to promote bone health. And yes, it's expensive. That kind of sucks. But at the end of the day, what you want is a good foundation.
Yeah.
So I'm reluctant to do treatment for somebody unless I'm confident it's going to last for a really long time. And if you have really low bone density, why go through all of this if it's not going to be a permanent long-term fix?
We kind of talk to patients about their 3-on-6 kind of like it's a car. And like, yeah, guess what? Tires can be expensive, but it's part of the maintenance. Yeah, oil changes can be kind of expensive, but it's part of the maintenance. I had to get my car serviced the other day and it was $400 and something. I was like, this is expensive, but I like my car. So we'll keep it going.
Those pills are important, but there's oftentimes really good deals on Amazon for the right ingredients. So don't get hung up too much on which ones you're taking. Look for the right quantity of the right ingredients and buy the cheapest one.
And they might be on a really good deal today because it's the
Is it
last
Amazon Prime Day?
It's the last day of Prime Day.
So get on Amazon, buddy. See if you can find some pills. There is a brand that 3-on-6 promotes, and had manufactured because it has all the right stuff in it, and we give that to patients.
Yeah.
But then they often, at my direction, just go online, look for the right ingredients, and buy whatever you can find for the cheapest.
Yeah, we kind of give you your first bottle. Hey, this is what you need to take.
Not kind of. When we take somebody on, we give them everything. We give you your pills.
Here's
We
what
give
you
you
need.
your water pick. We give you everything you need to have a successful
Yeah.
journey.
Toothbrushes,
Yeah.
toothpaste.
We're
all
out of
the
time.
things.
So,
we are out of time.
guys, I hope that you found this informative and helpful.
Educational.
If you are on the pathway for full mouth reconstruction, you really should consider all of your options. And we hope that you consider 3-on-6 as one of those options.
Yeah.
And if you do, we'd love to see you here in Las Vegas. Any closing thoughts, Tiffany?
I'm just really excited about going and having an MRI right
That's
now.
true. You do have to go have an MRI. That's why I had to do this early today. Well, it is an
Fine.
honor to be in a position to help so many patients from around the country
It's so
and help
much
you
fun.
guys with your journey to getting your perfect, healthy, beautiful smile and your perfect, healthy teeth. So any questions at all, hit us up at that phone number there. We're happy to help you out. We hope you guys have a safe and enjoyable weekend. And we will see you after the 4th of July.
Yeah, I had it so wrong. We'll see you after the 4th of July. So everybody have a happy, healthy, safe
Safe
4th
for-
of July.
Hey, did you
Everyone
see
keep
that
their fingers.
No fireworks allowed in Utah.
Yeah.
They outlawed
Zero.
fireworks. But it's because the whole state's on fire.
Yeah.
I mean, it
how-
makes sense.
I'm like, if you want to see fire,
It's a giant tinderbox.
drive to Beaver.
Yeah. Drive to Vegas. We're gonna have fireworks.
We'll
on the
have
strip.
fireworks down here.
All right, guys. See you.
Bye, everybody.
Happy 4th of July.
See you later. I have to get a drink.